Pour me another cup, will you? Take a look at your skin this morning. Maybe look down at your arm or look in the mirror. How does it look? Is it dry or patchy, red in any way? Dr. Tess Mauricio, America's favorite dermatologist, is here with what your skin may be trying to tell you. Good morning. Thank you so much for joining us.
Well, the skin is our largest organ, right? And it can really provide clues to how our, general condition is. And actually, during residency, when we're training as dermatologists, we are trained to look for skin manifestation of internal diseases. So a skin rash can be just a simple, like a contact dermatitis or allergy or even eczema, but it could really be a sign for something, more serious.
What should people be on the lookout for?
Well, it's common to have things come and go, but if you have a rash that is staying for many weeks, and if it's getting worse and not responding to over-the-counter, you have your Cordates and hydrocortisones, then you may want to consult your doctor and to make sure that it's not anything serious. And also, if that rash is accompanied by fever, chills, body aches, arthritis, definitely consult your doctor, because it can be a sign of autoimmune diseases and things that can be made better if the doctor finds out.
Right, if they can get to the underlying cause of it. In fact, you kind of answered it already, but we'll go back to our viewer question. This person writes in, Dr. Tess, I have a rash on my arm for a couple of months. I've used over-the-counter rash creams with no noticeable improvement. Is there something else Kim and Al Cajon should be doing?
Yes, well, Kim, this is probably one of the most common reasons a person comes to see a dermatologist. And as dermatologists, we tend to have to act like detectives. We want to find out, how long has it been there? Did it start off small? Is it growing? Is it spreading? What have you done? Or have you been exposed to pets? Because sometimes, you can get poison ivy, poison oak. Is it a contact dermatitis? Is it around the area where you normally have jewelry, and you may have nickel contact dermatitis? And also, there are patients who do have real eczema or atopic dermatitis, and if you've had this as a child, it can happen as an adult as well. I have that, and it, during dry season in the wintertime.
You have something wrong with your skin.
I do. That's why
I don't believe you. I do not believe you. Look at her.
I definitely have eczema, and so I have patches of itchy areas, especially during the wintertime, or if I go in the pool with chlorine. That can come out, and if you're not using enough moisturizers, it can make it worse. So, usually if it is there, comes and goes in a few weeks, it may not be serious. But again, if it's persisting, if it's getting worse, accompanied by fever, chills, muscle aches, arthritis, really consult your doctor.
Right. It could be, might be an underlying condition there that you need to know about.
And they can do simple tests. Also, another thing that's very common with women is hypothyroidism. And if you've never had eczema as a child and suddenly your skin just starts having rashes and very dry and your hair starts becoming brittle, you really want to make sure to check your thyroid. And of course, as dermatologists, we're concerned about skin cancer. And some people think it's just a rash or some flaky thing that they peel off and they put different ointments, and it's not going away.
And that could be a sign of skin cancer, and that's something people really should be aware of.
Absolutely.
Dr. Tess, thank you so much for your time this morning. We really do appreciate it. And if you want to get a hold of Dr. Tess, go to her website, mbeautyclinic.com. She's got clinics all across the county, in Orange County too. Still ahead, Bayer